Welcome back to our series on Chapter 1. In our last lesson, we looked at the current policy landscape and the trade offs of the Iron Triangle. But to understand where we are today, we have to understand how we got here. In this part, we're looking at the historical forces that shaped modern medicine, from the discovery of germ theory to the rise of the modern hospital and the birth of health insurance during the Great Depression and World War II. We'll see how early decisions about employer-sponsored insurance created the tax advantage system we use today. Let's dive into the history. Section 3. How the U.S. system developed. Three forces that shaped modern healthcare. The U.S. healthcare system didn't appear overnight. It evolved through historical forces that fundamentally changed how we think about medicine. Three developments stand out: the germ theory of disease, advances in medical technology, and urbanization. Let's take each one. Germ theory changes everything. In 1870, Louis Pasteur demonstrated that diseases have specific biological causes: germs, bacteria, pathogens. Before germ theory, medicine was largely about comfort. Physicians could ease symptoms, but they couldn't cure much. Diseases were blamed on bad air, moral failings, or imbalances in the body. Once we understood that infections came from microorganisms, medicine shifted from comfort care to curative care. Doctors needed laboratories, diagnostic tools, and centralized facilities to identify and treat disease. That meant hospitals became essential. Technology transforms medicine. Medical technology accelerated this shift. Surgeons first used anesthesia in 1846. Patients could now undergo operations without the agony, but surgery remained dangerous because of infection. In 1867, Joseph Lister introduced antiseptic procedures. Death rates from post-surgical infection dropped dramatically. Surgery became survivable. X-rays arrived in the late 1800s. Suddenly, doctors could see inside the body without cutting it open. In the 20th century, CT scans and MRIs pushed diagnostic imaging even further. Each of these advances made hospitals more powerful and more central to medical care. Urbanization and the end of home care. The third force was urbanization. As Americans moved from farms to cities, family structures changed. Extended families no longer lived together. People lived in small apartments or boarding houses. There was no space to care for a sick relative. There was no family around to provide that care. Hospitals filled this gap. They became the place where sick people went to receive treatment and recover. What started as charitable institutions for the poor became the center of the entire medical system. Section 4. The Rise of Modern Medicine. The Flexner Report, 1910. In 1910, Abraham Flexner published a report that changed American medicine. The Flexner Report was a devastating critique of medical education in the United States and Canada. At the time, many medical schools were little more than diploma mills. Training was inconsistent. Standards were low. Flexner called for scientific, university-based medical education. Medical schools had to be affiliated with teaching hospitals. Students needed laboratory training and clinical experience. The response was dramatic. Weak schools closed. Those that remained raised their standards. Licensing and credentialing became strict. The modern medical profession was born. Hospitals became central hospitals, became teaching centers. Medical students trained there. Residency programs expanded. Nursing was professionalized, and nurses became hospital employees. All of this made hospitals more complex and more expensive. They required specialized staff, expensive equipment, and constant investment. Healthcare was no longer something that happened at home or in a doctor's office. The hospital was now the hub of the entire system. The birth of health insurance. During the Great Depression, hospitals faced a crisis. Patients couldn't pay their bills. Hospitals couldn't cover their costs. In 1929, a group of Dallas teachers made a deal with Baylor University Hospital. They paid a fixed amount each month, and in return, the hospital guaranteed them up to 21 days of care per year if they needed it. This was the beginning of Blue Cross, prepaid hospital insurance. The idea spread quickly. By the 1940s, Blue Cross plans operated in most states. This was the birth of third-party payment. Instead of patients paying hospitals directly, an insurer sat in the middle. That changed everything about how healthcare was financed. Blue Shield and physician coverage. Blue Cross covered hospital stays. But what about doctor visits and physician services? Blue Shield plans emerged to fill that gap. Together, Blue Cross and Blue Shield became the foundation of private health insurance in America. The model was simple: pool risk across a large group, collect premiums, pay providers when members get sick. This basic structure still underlies most health insurance today. Section 5: Employer Insurance and Government Financing. World War II and Employer Insurance. Here's a piece of history that still shapes your healthcare today. During World War II, the federal government froze wages to control inflation. Employers couldn't offer higher pay to attract workers, but they could offer benefits. Health insurance became a way to compete for labor without raising wages. In 1948, the National Labor Relations Board ruled that health benefits were a mandatory subject of collective bargaining. Unions demanded coverage. Employers provided it. The tax advantage tax policy locked this in. Employer paid health insurance premiums are not counted as taxable income for workers. If your employer pays $10,000 a year for your health insurance, you don't pay income tax on that $10,000. If they gave you that same $10,000 as salary instead, you'd owe taxes on it. This created a huge incentive for employers to provide coverage rather than higher wages. It's one of the largest tax subsidies in the federal budget, and it's why most working Americans get insurance through their jobs. Medicare and Medicaid, 1965. In 1965, Congress created Medicare and Medicaid. Medicare covers Americans 65 and older. It's a federal program funded through payroll taxes and general revenue. Medicaid covers low-income Americans. It's jointly funded by the federal government and the states, with each state running its own program within federal guidelines. With these two programs, the federal government became the largest payer in the healthcare system. Hospitals and physicians now had guaranteed payment for elderly and poor patients. The double-edged sword. Medicare and Medicaid stabilized hospitals financially. Providers no longer had to worry about uncompensated care for large segments of the population. But there was a trade-off. When someone else pays the bill, patients and providers have less reason to worry about cost. Price discipline weakened. Healthcare spending began to accelerate. From the Flexner Report to the wage freezes of World War II, it's clear that our modern hospital-centric and employer-based system was shaped by very specific historical moments. We now have the infrastructure, but as any MHA or MBA student knows, infrastructure is expensive. In our final part, we're going to look at the cost explosion that followed these developments and the 10 core economic concepts you need to master to navigate the future of healthcare strategy. Don't miss the conclusion in part 3.